Hello, everyone. This is Chadi Alraies coming to you from RSH 2026. I'm really excited to be on another year in Structural Heart in Riyadh. This is first I want to review for the day, and today day one. A lot of science and presentation presented. I'm really privileged to be with a friend and colleague, Dr Bijulal Sasidharan, who talk about a new TEER device that's currently available in Asia. Technology, innovation, and how to treat these patients. Bijulal, thanks for being with us.
Thank you, Dr.
Yeah.
Shadi.
So we talked offline about this new device available in India. Can you
Yeah,
tell us about the background?
yeah, I'm excited to announce that we got a new device available in India, which is known as MyClip. It is from the makers of MyWell. MyWell, it is revolutionized therapy of TAVI in low resource countries like India and all, where the cost of TAVI was a major concern. Cost of these TAVI devices were a major concern. And once this MyWell, which is developed by Merrill Life Sciences of India, the cost has come down, the therapy has penetrated the masses. Now in India, we do around 5,000 to 10,000 TAVIs a year, and mostly maybe around 70 to 80% is with the MyWell. And of course, the other companies are also there. But the ones the therapy has penetrated the market, the other companies are also getting a good share. Previously, we used to do maybe less than 1,000 TAVIs a year in India. Now the number has become 10 times more than that. So this is the same thing which is going to happen with the TEER also. Right now, the number, even though TEER MyClip was launched in India in 2020, I believe, the number of cases were few because the high cost of the device. Now this Merrill has come out with a new device which is known as MyClip. It is somewhat similar, almost similar to other commercially available devices, but it comes at 30 to 40% less cost. So it is going to penetrate the market. So the more physicians will adopt this therapy because it's more affordable to the patients.
Sure.
In India, it's not a government supported therapy.
And the device is indicated for both functional and degenerative.
Yeah, it is exactly somewhat almost similar to other devices. So it can be used in functional MR as well as this degenerative mitral prolapse MR also.
Okay.
And when you look, it is approved by the Indian FDA, which is known as CDSCO. CDSCO has approved this therapy for clinical use. It is also used in other countries, some of the Central Asian countries like Kazakhstan and all.
And just
Also,
for the
it's being
audience to give
used.
them an idea, what is the prevalence of mitral valve disease in India? I know there is a lot of mitral stenosis too, but the MR.
Rheumatic fever, it is coming down in India. Previously, when I started my practice 20 years back, we used to do so many mitral valvuloplasties a week or a month. Maybe we may do around 10, 15 mitral valvuloplasties. Now it has come down. So the prevalence of, from my own practice, I can understand the prevalence of rheumatic heart disease has come down in India. It is probably, I would say, it has come down by 50 to 70%.
Right. And then in terms of the study that was done for approval for the new device,
Yeah.
was it done in India? It's
Yeah, it was
multi-center or
done.
just
It was done. I believe it was done mostly in India. Most of the cases were in India. The first study that initial first-in-man study consists of around 50 patients with a 95% success rate and hardly any complications. And
the sheath
this
size? If you can walk about technical
it
aspect
is
of the device.
same. It is, I think, 24 points,
24.
similar to. It's exactly similar to the other commercially available devices. You can
Right.
even call it as a copy, but that's how the science progresses.
Right.
You need competition. Then only
Right.
the others will start innovating. Otherwise, it will be a sedentary market. Now,
And you, yeah, go ahead. Sorry.
now this Abbott has already come out with the fifth generation.
Right. Right.
So competition is good for everyone.
It is, yeah. It lowered the cost and have more option for
Yeah,
patients.
it will penetrate the market. It will make it affordable. So physicians will adapt. People will come to know that such a therapy is there.
Right.
Then the other companies will also get their share.
Right. Yeah.
Okay. So
Absolutely.
that's what happened to TAVI. When
Yeah.
we started TAVI in 2016, 17 like that, hardly any takers because of huge cost involved.
Yeah.
Cost involved.
Well, again, thank you so much for new technology available for affordability for the patient, number one.
Yeah.
And thanks for presenting it here at Riyadh Structural Heart in 2026. And I'll
Thank
look
you. Thank
forward
you
to
very
see you
much,
again.
Dr. Sherry.
Thank you.
Thank you.
Please watch these videos and others on the YouTube channel. This is Chadi Alraies coming to you from Riyadh Structural Heart 2026 in Riyadh, Saudi Arabia. Thank you so much. Thank you.
Thank you.